Dr. Jaffe, is there any special set of supplements that one would need to take before having an X-ray, and maybe after having an X-ray, depending on what it does to the body?
Well, both the X-rays and the stress of the procedure mean you need more ascorbate, more of nature's vitamin C, our PERQUE Potent C Guard. I would take an extra teaspoon or two. I would check the C cleanse if I could before, and then a week after. X-rays are a source of radiation, ionizing radiation. And we now know much about the fact that the machines are often not ideally tuned. They often have spurious X-rays. Goffman and many others have shown that if you have plenty of antioxidants like ascorbate and polyphenolics, that there is no harm from X-rays, from a routine chest X-ray, from a mammogram, from a CAT scan. Now, I prefer to keep down the number of radiation exposures I have in my life. So I would prefer an MRI, maybe a PET scan rather than a CT scan, but that must be decided in the moment based on what's going on with the individual. So yes, increase your antioxidants, and that will help with the stress, that will help with the procedure, that will help with the small but significant risk that comes from X-rays. It turns out that if you take a plane that goes the polar route, you would also want to increase your antioxidants because it's about the equivalent of 25 chest X-rays to take one flight. And there are certain airlines that actually encourage their staff to take extra vitamin C a few hours before, during, and for a day after those flights. So we do know enough to know to limit the number of X-rays we take and to make the best use of the X-rays that we do take, so they should be expertly interpreted. And yes, you can mitigate, you can avoid the harm that comes from X-rays by increasing your maternal antioxidant, your ascorbate, your PERQUE Potent C Guard intake, and polyphenolics that go with the ascorbate to prevent harm.